Hey folks, Doug Blake with Body Design University. Welcome to another weekly study. And in today's video, I want to talk to you about a subject that came up in one of our posts in our Facebook group. And it is related to chapter 7. It's actually a good point. And I wanted to clarify kind of what the issue was, because I understand where this student could get confused. And I want you, and I'm going to reference now back into chapter 7, page 223. And the post took a shot of the paragraph, and the student said, you know, I'm a little confused, and for good reason, I would think. And it was about this one paragraph where it says heart rate is a valid indicator. I'm on page 223 if you've got your textbook. It's a valid indicator of work intensity or stress on the body during exercise. Fair enough. And he circled that part. And then he was confused because in the next sentence, it says, however, because so many factors can influence resting heart rate and their effects can vary greatly from one person to another, resting heart rate is less valid. And he circled that. And honestly, when you read it, I would be thinking the same thing. Maybe what ACE is doing is they're comparing our heart rate during exercise as a valid indicator of something, but then you don't need to do resting heart rate. Why then worry about resting heart rate? And that basically was the gist of this student's post. And he's confused and he's going, well, heart rate itself is valid, but resting heart rate? Well, no. So that's what I want to clear up for you in this video, and hopefully this helps and doesn't confuse anybody. Because chapter 7 is the resting assessments and anthropometric measurements, ACE is now going over with you, like from the beginning of this chapter, basic assessments, resting, and then of course they'll speak to the assessments where you're actually doing, you know, movement exercise and things like that. So cardiovascular and strength resistance assessments. This is just the very beginning of the assessment sequencing, right? So you're just going to have basically a client sits down and you take their blood pressure and their resting heart rate. So the question here then is, well, why do I need to know resting heart rate if it's not valid? Well, that's not what ACE is talking about. ACE is not comparing resting heart rate to heart rate during exercise. Let me see if I can help you understand this. The first sentence basically tells us something that we already know, and we know it intuitively, is that when I start jogging and my heart rate is at 60 beats per minute, and I start jogging faster and faster, what happens to my heart rate? It goes up. Everything else being equal, it goes up. Now, take the idea of using a blood pressure med, other stressed conditions that may affect elevation in heart rate. That's fine. We know that certain blood pressure medications, beta agonists or whatever, ACE inhibitors, can blunt heart rate response. Put that off to the side. All this is saying is that heart rate during exercise is going to change, and it's going to change according to the intensity or stress on the body. So heart rate is a valid indicator of work intensity. The harder you work, in other words, work intensity goes up, heart rate goes up. Work intensity goes back down, heart rate goes back down. And what I want you to do is just to take that and put it off to the side now, and don't make any connection with the next sentence. I get the confusion. Trust me, I'm always looking through the textbooks and going, why did they have to make a connection using different terms and words? And I believe they did that here. It says, however, because so many factors can influence resting heart rate. Stop. All ACE is saying is that resting heart rate is influenced by many different things. And they actually tell you, and they give you a list of things that will affect and influence resting heart rate. Resting heart rate can be high in a fit individual. That's all they're saying, is that a resting heart rate, forget about heart rate while you're exercising. just resting heart rate in and of itself, when you take your resting heart rate, it could be 50, could be 80, 70, 60, whatever that number is. That is not, it is not, resting heart rate is not the best indicator, not compared to heart rate in this first sentence, but it's not a good or valid indicator really of anything for the most part. That's basically what they're saying. Now, just keep in mind, we do know that when everything else is equal, when the playing field is leveled, we do know certain things about resting heart rate in the same individual, whether their heart rate is 50 beats per minute at rest or 80 beats per minute at rest. What we know if that individual is unfit. Remember, just because you're unfit, you never work out a day in your life, doesn't mean your heart rate can't be 50 beats per minute like a trained endurance athlete. No, that's the whole point, is that resting heart rate has lots of variables. You can take the resting heart rate of anybody on the street, and you can't make a good assessment just by looking at that individual. There is a general change in cardiovascular and cardiorespiratory fitness when you do low to moderate consistent training over time. Your resting heart rate, whatever it's at, will generally go down. But remember, if my starting resting heart rate is 80, because of genetics and all the other things that ACE has listed here, influenced by many factors: fitness level, fatigue, genetics, body comp, drugs, medication, alcohol, caffeine, stress, lots of different things that influence your personal resting heart rate. Let's say mine is 70, or let's say 80, okay? Yours is 60, but I run marathons, okay? I don't, but let's just say I do. Just because I run marathons doesn't mean that my heart rate my resting heart rate is going to automatically be low. Now, more than likely it will be, but compared to what it was when I first started training and doing marathons, it's probably significantly lower. Could be 5 to 10 beats per minute lower. Resting, your resting heart rate, you sit down, take 5 minutes, take your resting heart rate, and it's 55 beats per minute. Okay, so what does that mean? Does that mean you're fit? No, it doesn't. That's the point, is that resting heart rate is not always a valid indicator of anything, right? Because your 55 beats per minute resting heart rate could just be a genetic issue. Maybe you have a larger heart. I don't know. Maybe you're very light. You don't have a whole lot of body weight, so your cardiac output may not be as great, and therefore your stroke, whatever the case is. You're a male, right? Males generally have lower resting heart rates than females. You get the idea. So resting heart rate, don't connect those two sentences together. Because again, that's what's going to confuse you. Well, heart rate compared, no, two totally different animals. A person with a resting heart rate of 50, what happens when they start to exercise? What happens to heart rate? It's a very valid way to measure intensity. If my resting heart rate starts at 50 and I'm sitting here and I start to exercise, what's going to happen to my heart rate? It's going to go up as my working intensity goes higher. So whether I'm at 50 beats per minute resting heart rate or 80 beats per minute resting heart rate, what's going to happen to my heart rate when I start to increase my working intensity? They both go up. I hope that makes sense. So working heart rate during exercise is very valid. Duh. Again, unless you're on heart rate modulating medication like certain blood pressure meds. Get it? But resting heart rate as a standalone measurement it's not necessarily a valid measure of anything, right? Other than that, you got a resting heart rate of 60. Congrats. Okay, whatever. But you can have a resting heart rate of 50 and have cardiovascular disease. Yeah. You can have cardiovascular disease and have a low resting heart rate. You can have bradycardia. You can have any of these conditions that a physician will look at and go, oh man, you got a low resting heart rate. Again, the physician will look and compare all the other variables, biometrics, your blood pressure, all these other things. The point is I want to make sure that we clarify what that paragraph means. So when you're going through here, don't get confused about this. Resting heart rate, that's why we have research studies. It's inconclusive. Just because you take somebody's resting heart rate and it's 55 beats per minute and go, wow, that's really good, right? Well, no, I just had a stroke 5 months ago. I'm in rehab. That's not good. Okay. You can't use resting heart rate as a definitive variable to say anything about an individual, because there are so many variables that affect it. Whereas during exercise, your heart rate, just your general heart rate, is going to go up generally. And then when you stop exercising, it's going to go down. That's why it's a valid measure of exercise intensity. But resting heart rate, like I say, you can, and trust me, you can Google it and you'll see endurance athletes who in some cases have 60 beats per minute as a resting heart rate. Now, I knew a guy. Now, New York City firefighters, right, are generally in really good shape. And a friend of mine, his resting heart rate was in the 40s. What? Yeah, that's a pretty strong heart. Now, chances are before he started, the normal exercising, he probably had a low resting heart rate to begin with. Again, I'm just telling you that experience tells us certain things. If you have a normal resting heart rate of 80 and you train endurance training for 5 years, the chances of you having a resting heart rate in the 40s just because of training, probably not going to happen. Okay, so hope you get that. Here's the other thing that I wanted to explain on this. When you're going through this part of the chapter, to memorize it, so that should clarify that. That's all they're saying in the expand your knowledge, resting heart rate. So the question really that this student brought up in the post was, well, then why take resting heart rate? Well, I hope that dispels the reason right off the bat. But if it doesn't, turn the page. Here is why we take resting heart rate. And by the way, what I would be doing on here, this is where you grab your sheet of paper. I talk about this all the time from a memorization standpoint. Once you hit, let me go into this camera. So once you get to these bullet points in the general study guide, I normally will say, as long as you got enough time, go ahead and write your bullet points and write them out. In this case, it's probably a good idea. You probably already know a number of these bullet points, but these are where I would then take the bullet point, and it might be a little bright for you to see it, but this is on page 224. And so you would simply write each of these bullet points. My recommendation is that when you're writing these bullet points, it's not necessary. This is just a tip. You don't have to write out the entire paragraph. What I would do is I would read it and I would kind of say to myself, how could I write that bullet point out in a couple of words? And I'll give you an example. So the following are some key notes about resting heart rate. Okay. And then there's 1, 2, 3, 4, 5, 6 bullet points. So the first bullet point says, knowing a client's resting heart rate provides insight into his or her potential for developing the overtraining syndrome. Now you get it? Why do we take resting heart rate with our clients as a normal baseline assessment? That's a really good reason. In fact, when I used to train athletes, I would have them take their morning body temperature and their morning pulse before they even got out of bed. You know why? Because as any elevation in resting heart rate above 5 beats per minute over the client's normal resting heart rate that remains over a period of days is a good reason to reduce or taper the intensity and total volume of exercise. I'm not saying you're going to do this in the real world. The average client probably, if you're doing things correctly, you're not going to overtrain them. unless the intensity and the total volume of training that you're doing with them is too high. But the point is for that bullet point, I would not write out that whole thing. I would write the following keynotes about resting heart rate. And I would do this. Let me show you so you can actually see it as I'm writing it. So here's the bullet point. I would do this, and I would simply say keynotes about resting heart rate, right? So resting heart rate. So in order to memorize that one bullet point, for instance, I would simply write overtraining, potential overtrain. See, potential overtrain. That would be like the first potential overtrain, and greater than 5 beats per minute. I hope that makes sense. So what you see here in this paragraph of information, which is getting all that light on it. Okay, you got it if you have the textbook and you're on page 224. That's the way, by the way, that's how I generally am going to do my notes. Okay, real simple trick. I shouldn't say trick, but it's a tip, okay? Don't remember, when I talk about read, write, recite, and rewriting over and over and over, you gotta also be smart about it. You're not gonna rewrite paragraph after paragraph. Get yourself, looking at the paragraph and get yourself thinking in a couple of words, sentence, how can I rewrite that? And that's what I would do in here. So there's your tip on studying for memorization. Overtraining syndrome. So one of the things we know is that resting heart rate will elevate, and they're giving you literally above 5 beats per minute. So if your normal resting heart rate, and you got to make sure that the testing is consistent, same time of the day, same physiological conditions, blah, blah, blah. 60 beats per minute, normally 61, 59, 60, whatever the case is, boom. And then the next day or a couple of days after, it's 66 beats per minute. And then over the next 3, 4, 5 days, 66 beats per minute, 65, 68, 66, 67. That's a pretty good indicator that, you may be dealing with a overtraining scenario. Certain drugs, meds can directly affect resting heart rate. Individuals should abstain from consuming non-prescription stimulants, the pre-workout stuff that I know some of you love to use, and hopefully you're not telling your clients to use. Body position, either lying down or sitting up. The point is that resting heart rate is an important biometric piece of information. Environmental factors, psychological, emotional stress. And as you continue to move down, look at all these bullet points. Just the idea is that when you see a bullet point, if you can compress it into a couple of words, something that's easier for you to remember, draw a picture, whatever the case is. I hope that this was helpful, because when I see a post, right, or questions come in where there's some confusion on the text and the information from the text, I definitely want to clarify that for you. And the way I'm reading it is in case, right, you confuse heart rate, just taking heart rate during exercise, versus resting heart rate. Don't confuse the two. Also, yes, resting heart rate is a very important number to kind of know on a regular basis, especially every 30 days when we recommend you do assessments and reassessments. So again, if you read through that and you get confused that they're saying one is valid, yes, it's valid for exercise intensity. Don't confuse it and don't connect it to resting heart rate, which on its own is not the best indicator of anything. It's when it changes for you in particular, everything else being equal, generally we like to see a lowering of resting heart rate, which can be, if you've been exercising, you're not taking any meds or whatever the case, you're exercising and you're doing a lot of cardiorespiratory endurance training, right? Lower to sort of moderate intensity training. If you're doing that over weeks and months, you start to see a lowering of resting heart rate. Well, that's probably a good indicator. But you wouldn't need to know that resting heart rate has changed, correct? Because just your cardiovascular training itself will have its own benefits. I hope this was helpful. If you have any questions, of course, let us know. Post them in the Facebook group, put them in the comments below. Go to the link in the descriptions if you want any more information on Body Design University. And just keep in mind, we do this every week. So you can subscribe to our YouTube channel, hit the bell so you can get the notifications when all of our new content comes out. Thanks a lot. Have a great weekend. We'll see you next week.